Hi, it's Tom here from Running Physio. Today I want to talk to you a little bit about one of the most important parts of working with injured runners, and that's how to help them get back to running. That return to running phase is so important, and often it's a stage that runners struggle with. They have setbacks, they have flare-ups that stop them getting back to their level that they want to get back to. So I want to talk to you about 3 common clinical scenarios that we'll come across and how you can work through each of those to successfully guide people back to running. Now, before I dive into that, I want to point out that for a short period, Running Repairs Online, our online course, is open for enrolment. And we've got a fantastic bonus bundle if you enroll today. That's closing fairly soon, that's devoted to return to running. So I'll talk a little bit about some of those resources as we go through this video. Okay, so let's think about some of the common scenarios we see in clinic. The most common scenario I'll often come across is actually with a runner where you feel you can continue running, providing you can find a manageable level. So your classic example here might be someone with, say, Achilles tendon pain, a bit like we talked about in our recent Achilles tendinopathy series. They actually can identify a manageable level of running that you can build from. Now, what you'll often need to do with patients is delve into that a little bit. Ask them, is there an amount of running you can do where the pain during is fairly mild and it settles quickly so it's back down to your kind of normal levels within 24 hours. So if you can identify that manageable level, you can then build from there towards where they want to be. Now, what I would say with this, one top tip is you're better off going slightly lower and building up than doing too much. So if you're not sure, if they say to you, well, I think I can manage about 4K and it feels fairly good, why not go a little bit less, start with 3K and build from there. In terms of how to build, I'd encourage you to use the time that you've got. So if someone's building towards an event and you've got months and months to build to that, don't rush the process. Use the time you've got to gradually build up their distance and then their intensity so that we're not rushing the process and getting flare-ups. And as you build, of course, you're going to monitor their response, making sure that any symptoms they have stay mild during the running and settle quickly afterwards, ideally the same day, but they shouldn't be feeling a flare-up of their symptoms into the next day. If it's someone with tendinopathy, they shouldn't be seeing lasting early morning stiffness the following day, for example. These are the sorts of things that you look out for. Now, I'd say in clinic, roughly 70% of the runners I see, if I work closely with them, I'll be able to find a manageable level to build from. Now, for me, this trumps a lot of the other tests that we're going to do. If they can say, I can manage this amount, that's where we're going to build from. And this approach is preferable because it avoids long periods away from running, where we get deconditioning, we lose fitness, and then as we return, we start to pick up secondary injuries. Other tissues that are now no longer used to running start to get irritated and painful. So if you can, find a safe and manageable distance for your runners to work with. I would try and do so, but obviously you've got to assess it on an individual basis. Now, I mentioned we've got some great resources for you in our bonus bundle. A couple of them that I might use in this scenario would firstly be our return to running decision tree, which we've included in this bundle. Now, this would help us actually decide whether this runner fits this category. Should they be continuing to run or should they be focusing on the right areas of their rehab? This decision tree helps take you through those choices so that you can make the right decisions with the patient and get them back to the running as you want to. Another thing we've included in this bonus bundle are race plans. So we've got race plans for 5K, 10K, half marathon and marathon with clear inclusion criteria. So things you want the runner to be able to pass in order to actually go into those race plans. Things like target distances they should be at to begin with. And of course they're flexible. So you can change them to suit each runner that you work with in clinic. So a couple of things from the bundle there that would be useful and I might use actually in clinic when I'm working with patients like this. So that's our first common scenario, someone where we can identify a manageable level of running and build from there. And we want that to be the case as often as possible for our runners. Scenario 2, I do also see regularly in clinic, is when you have someone who needs to take a short break from running to let symptoms settle. Your classic example here would be someone with something like medial tibial stress syndrome. Now that doesn't do very well continuing to run with pain. It takes a long time to settle if we just keep working with pain. Even sometimes low levels of pain can prove too much in that. So we try and keep this as pain-free as possible, both during and after running. Now, what we would want to do then in this example perhaps is delve into how irritable the symptoms are, determine their readiness to run. And if they're saying they're getting pain with day-to-day activity like walking, and maybe when we test their impact tolerance, things like jogging on the spot's painful, it's unlikely they're going to tolerate much running. And rather than continue and irritate symptoms, we can give them a short break, typically maybe couple of weeks, to let things settle down and then plan a more graded return when they're less irritable. So we're looking out then for signs that irritability is settled. So minimal day-to-day pain, no pain with walking 30 minutes, etc. And then we're planning a graded return. Now that 2 to 3 week period where they're resting from running, you can focus on other aspects of rehab. You could focus on cross-training. You could focus on recovery and general health factors if necessary to prepare them for that return to running process. Now, in this scenario then, when they're having to take a short break from running to let things settle, again, there's resources we've got in our bonus bundle that can prove useful. So we've got patient handouts for them about their pain, their recovery, and how to make progress. So it keeps it nice and clear and simple, and you can share these with your patients to help them with return to running. And we've also got our detailed therapist return to running guide. This has got 4 clear steps you can follow for the return to running process, including details on testing readiness to run, which would be so important for this patient. It isn't just about timeframes. It's not just a question of saying, right, you've had 2 weeks off, now you run again. It's about testing them and assessing them and seeing, are they ready to run? And we detail that in our return to running guide, which also comes as part of this bundle. So in this scenario then, maybe we give them a couple of weeks rest, we test their readiness to run, we see the symptoms have settled and they're tolerating impact, and then we gradually build them back in towards their target level. Scenario 3 is something I also see fairly regularly in clinic. I see a lot of patients where they're more complex cases, and scenario 3 would be people where actually they're not quite ready to return to run yet. They're not going to be ready in a couple of weeks. These are your more complex cases which need what we call a rehab ladder approach. So they need a more diligent approach to address their strength, control and flexibility. And of course, we talk about how you can assess this and address this in running repairs online. And they need a more diligent approach to restore their impact tolerance and then have a more graded return to running. So for example, a patient I saw recently hadn't been able to run for 2 years. So these patients often have had classically a break from running. She'd had knee surgery, she'd had arthroscopy, she'd had steroid injections. She'd actually reached a point where she'd been told perhaps now was the time to stop running. And I was kind of the last resort for her, which is often the case for runners. So in this situation, we can't just continue running. We haven't got any running to continue, to be honest. A short break of a couple of weeks is not going to prepare this person to manage running, especially when they've had multiple attempts in the past that haven't succeeded. So in this situation, we need to be much more thorough. We need to assess strength, control and flexibility. We need to start to introduce some light impact when they're ready to. And that's a top tip I take away from this video. One of the things that often separates sort of general rehab with running specific stuff that gets people ready is the inclusion of impact. Quite commonly, I see people that have done some really good strength work, but they've never really introduced impact. So as soon as they return to running, they're not used to that impact. Things flare up, they become very despondent, and they stop again. So in this patient's case, we worked hard to help her restore her strength, to make sure the knee was comfortable and quiet. I'm sure you're kind of familiar with that term. A quiet joint is one that's not swollen, doesn't have any restriction in range, isn't irritable. And then we started to introduce some light impact. And this can be really simple stuff. It might be a little bit of skipping, a little bit of jogging on the spot potentially. It's things to start to get the body and the joints used to impact. And we gradually build up that impact time till they're managing typically around about 2 to 3 minutes of impact, because then we're going to move on to a test run. And the test run for me, for patients like this, is often very short, typically maybe 3 minutes. And we use a 30-second walk break every minute. Now, you might think that's very cautious, but often with these patients, there will be a delayed response to load. So we can't simply go on how they feel during that test run. What we need to do is actually be quite scientific, test a certain amount and see how do you respond during that and afterwards. And I like, if you can, to get out, go running with that patient. Actually, not just tell them what they can do, but show them what they can do. I think it's nice for them to have that support. So our clinic's based in Hove in the UK. I'll often get people out in the sunshine, have a short run with them, guide them in terms of when to stop for a rest break, and then see how they respond afterwards. And then once we've tested that, we can build from there towards where they want to be. So we've got some resources again in our bonus bundle that's available if you sign up today to help you with this process for these patients that are a bit more complex. So we've got our run through. This is a session by session guide that takes you from the initial assessment all the way to end stage rehab and talks about what you want to focus on in each session. What are your session standards? What are your goals for each appointment with the runner? How do you test their strength, control, and flexibility? How do you progress them? And we've also got our return to running programs. We've got 6 different return to running programs in this bonus bundle. So we've got options to suit every runner that you're likely to see in clinic. Now, our first plan that we include in that is a very gradual, cautious return. And this is going to be appropriate for those people that have struggled with the return to running process in the past. So within this, we usually include walk breaks. We'll gradually and consistently progress over a period of time, because it's better to be consistent than to rush the process, have a flare up, and then have to spend time calming things down again. So those are 3 common clinical scenarios I would see in clinic. With the first one, if you can identify a manageable level of running for your runner and it's safe and appropriate for them to do so, that's often a really good option. And I would aim to find that manageable level and then gradually build towards their goals. For that second option, if they're a bit irritable to run at the moment, sometimes a short rest period to let things settle can calm symptoms down, and then you can plan a graded return. And for the third option, those more complicated cases, we need to be more diligent to address their rehab goals, their strength, their control, their flexibility, and their impact tolerance before planning a graded return to running. And in those groups, think about the bigger picture here. Do we need to help them get a little bit fitter so that they're ready for that return to running process? Do we need to think about general health, maybe weight management? Are they recovering enough? We've had patients that have had real issues with sleep and recovery, and we've decided to help them address that first so that they're ready for that return to running process. So it's about preparing them, setting clear targets that we talk about in our return to running guide, and then gradually returning them and keeping working towards that consistency and towards their goals. Now, a couple of other tips to add into this is that it's important not just to plan the return to running, and I'd encourage you to do that, plan the progression, use the training plans we've provided in our bundle if you'd like, but it's also important to plan recovery. And we include suggestions for recovery days in our training plans. So typically plan recovery into their training week so that they're nice and fresh for their longer runs, but also plan recovery into the longer term training plan. So typically every 4th week, for example, we might have a recovery week. I'd also consider for those complex cases where they've struggled with return to running before, and particularly those ones that have hit a certain distance and then find they can't progress, is consider using a consolidation period with those runners where you work just below that challenging level, sometimes for maybe 3 to 6 weeks, to get them used to that. I almost want their bodies to get a bit bored of that distance, to get so used to it that they're ready to progress. So let's say a runner say, every time I get up to about 5k, I get a flare up in my hip symptoms. As soon as I push on through that, it stirs everything up and I feel like I'm back to square one. So with that runner, I'd say to him, well, why don't we build you up to maybe 4.5k, and let's sit at that distance, as I said, for maybe as much as 3 to 6 weeks. Let's get that really consistently comfortable for you. Get your body used to it, allow you to adapt to it. And maybe during that period, if we're not pushing on with training, let's really build your strength and make sure you've got adequate recovery and address your other needs, general health needs, etc. And then you'll be in a great position when your body's used to that distance to push on gradually towards your target distance. Okay, so a few thoughts on the return to running process. I'd love to hear from you. If you've got any questions, any parts of return to running that you find challenging with your patients, that you think we can help with, just let us know in the replies. As I said, our online course, Running Repairs Online, is open for a short period. And if you sign up today, you will get that fantastic return to running bonus bundle with all those resources, the return to running programs, training plans, the session by session guide, your guide to return to running with those 4 clear steps in it, as well as the patient handouts and the decision tree. All of that's within that bundle, but that offer closes very soon. So I'd encourage you to sign up today, access all 18 modules of our course, and you'll get that fantastic bonus bundle. Okay, thanks very much for listening in. I'll be back to speak to you all again very soon. Bye for now.